For 30-year-old Stella, the results of medical tests were to change her life. At 29, she was diagnosed as having cancer of the cervix. Ironically, Stella owes her life to radiation, which can be deadly.
Well, they first detected the cancer because at this visit to the GP they did a smear test, and unfortunately that came back positive. And they then asked me to go to the hospital, where they actually realised through various other tests that it definitely was a cancer of the cervix.
Stella had a cancer of the cervix, which was a cancer which needs to be treated by radiotherapy. When we talk about cancer, we're talking about the uncontrolled growth of cells. Normally, there is a good balance between cells being generated and growing and cells being lost and dying. But in cancer, what happens is that balance becomes deranged, and instead we get more and more cells growing, and they form a lump. Radiotherapy damages all cells. It damages the nucleus of the cells and stops them dividing. But it damages cancer cells in a way that they cannot repair, whilst normal cells are able to repair the damage, so that over a period of time you can kill off the cancer cells whilst leaving the normal cells healthy.
The first part of my treatment was a series of 28 sessions on a machine at the hospital which is called the Linac accelerator, and that sends out very high dosage of X-rays, which is part of the radiotherapy treatment. And I lay down on a bed under a big machine, and the machine actually sends out these X-rays.
And those high-energy X-rays are directed at the cancer, which is at the centre of the pelvis, and at the lymph nodes, which are at the side of the pelvis here. This high-energy X-ray treatment from the Linac accelerator is at about 100 times the energy of the X-rays that we use to take an ordinary X-ray picture, as you would have of your chest, and the dose which we deliver to the tumour is about 100,000 times the dose which we would use to take an ordinary picture. The only difference between X-rays and gamma rays is where they come from. Gamma rays come from the nuclear decay in a radioisotope, whereas X-rays come from a machine which works at very, very high voltages, often in the range of millions of volts.
The second part of Stella's radiotherapy was her internal treatment.
What I'm going to do is I'm going to use a bit of anaesthetic down below so that you don't feel anything, and then I'm going to slide this tube here through the cervix and into the uterus and connect you to the treatment machine, which will put the radioactive isotope into the applicators. So I'll see you in a few minutes when the treatment's over.
Okay.
Whilst the treatment's going on, you'll hear various clicks and whirs from the machine. Don't worry about those.
Okay.
And there's also a continuous bleeping noise, which is the gamma monitor.
Right, okay.
All right?
Yeah.
At the end of 12 minutes, we'll come back.
Okay.
Last out.
Well, the radiation doesn't just stop inside Stella when she's having her treatment with the radioisotope. And if the staff who were treating her were to remain in the room, they would all get some radiation, even though it would be a small dose. Now, whilst it's reasonable for Stella to receive some of that radiation because she has a cancer, which is a very serious risk to her, it is not reasonable for people who do not have cancer to be exposed to radiation.
So are you happy with the films, Dr. Blake?
Yes, I think that now we've done the insertion, we can see on these films that the tube is nicely within the uterus and that the applicators are at the top of the vagina. With the correct positioning, we can go ahead with the treatment now.
Ready to switch on?
Mm-hmm.
The radioactive source is put into these tubes by the machine in order to deliver the radiation in a concentrated form around this area here, which is where the cervix is sitting. And so that is the area that gets the biggest radiation dose, and therefore we're able to cure the cancer.